Okay, good morning and I guess good afternoon to some folks. My name is Bob Egan. We still got a number of people that are joining the webinar, so we're going to just hold for about 1 minute and then we're going to get started. Thank you all for joining us. Once again, we still have a number of folks that are joining us, so we're going to hold for about 30 seconds before we get started with this exciting webinar. All right, good morning, everyone. My name is Bob Egan. I'll be your host today. I'm advisor and CEO of Separate Group and working with GigaomÚ's on Samsung. An exciting webinar today talking about the business challenges, specifically this new trend and a very important trend around mobile device customization. Again, this is sponsored by Samsung, and I have some really great, talented participants. Valerie, who represents Samsung and is responsible for Knox, Bharat with HipaaxÚ's, and Kyle and Ed from UC Health. And I think you'll find that this is a very provocative, and hope that you will learn a lot from the kinds of challenges and opportunities that were presented by the solutions that HipaaxÚ's and UC Health have put together along with Samsung on behalf of their clients and customers. I'll ask each of them to talk a little bit about who they are, and then we'll dive in. And I think the real thrust of the kinds of things that we continue to see is that mobile is not only mainstream, but the more we learn, the more we do. The more agile we expect our employees to be, and the more agility we want to bring to those employees and their customers. And so it continues to change the game each and every day. I think there are really three big things that in every solution that I think about as I work with clients, it's about what are the opportunities? What are the opportunities for your customers, your clients, your supply chain partners, and also for people who work within your organization. It's also about trust and privacy and security, and especially in today's world, where we continue to see the importance and the requirements of trust and security continuing to ratchet up and set new bars. And then, as always, it's not deploying technology for the sake of technology, but it's really providing impact and business outcomes that allow your organizations to do better in terms of the kinds of solutions you deploy to your clients, your customers, and also the workforce. So without further ado, let's dive in to three key issues, and starting with as I divided this up, key issue number one is really to talk about the business impact of mobile technology. So Ed, talk a little bit about what you were trying to do, what you were trying to accomplish at UC Health, and what are some of the challenges and how you were addressing those challenges to those specific business problems.
Sure. Thanks, Bob. So we had at UC Health kind of a unique challenge in Colorado where we're hospital. We're located in Denver, and we have as part of our system hospitals in other parts of Colorado that we were trying to kind of standardize care between. One of the big projects that we're working on is something called bedside. So with our EMR, our electronic medical record system, which is Epic, the application bedside is something that they offer and that we were trying to integrate so that patients could actively be able to see their healthcare in real time as they're inpatients within the hospital. So to do that, we were using Samsung tablets in the Android platform, where with the application, patients could be logged in and actually be able to see everything from their vital signs in real time to their upcoming surgeries or MRIs or different things that they might have in the hospital. It allows them to actually see their care team and interact with their care team in real time, as well as things like order food through the application on the tablet. So each patient in the hospital, in that sense, would get a tablet, and they would get logged into this particular application, but they would also be able to use the tablet as an entertainment device. So we wanted them to be able to use it to interact with the outside world, which is kind of hard to do when you're a patient in the hospital. So everything from being able to look at Facebook, to go on their Netflix account, and to just go on the web and check their email, to do whatever they want to do with their family and the rest of the outside world. So, but one of the particular things with us, we needed something that was in a secure fashion, that these tablets then would be wiped clean of any data from the patients. They wouldn't have to worry about any PHI or personal health information that might be on there. And we wanted it needed to be done in a rapid fashion, because this is something that they interact with the nurses with. The nurses help them log into their account and help them potentially to log out as well. So one of the things that we first came up with was working with Samsung and coming up with the Knox customization package, where we could actually have the tablets wiped back to really kind of an out-of-the-box or a factory clean slate. So there's something where they come on, so there would be nothing left on there that the patients would be worried, or we'd be worried that any content would be left on there. And with Knox and Samsung's help, we were able to develop really this kind of a first step where there was an application run and the tablets were wiped back to this factory state.
So Ed, let me interject for a minute. This is pretty unique, because at once, but by definition, a lot of the deployments people would deploy where a lot of the applications are anonymous, right? But as you're giving patients, the notion of anonymity was just not there anymore, because they had access to their medical records, their charts, appointments, scans, their vital signs, but as well the more generic applications that were more entertainment-based. That presented some really big problems for you, I guess, right?
Exactly. Because everything from, their email that was on there, their Facebook app, they could actually download any app that they wanted on these tablets, and we encouraged that because we wanted them to be able to kind of be as relaxed and as informed as possible within the hospital. But you're exactly right. So the issue was, how do we get rid of all that data? How are we comfortable and they're comfortable that nothing is going to remain on that tablet that could come back to, expose them or ourselves in that sense? So the solution that we came up with, again, working with Knox, was great, and we wiped it back to that factory clean slate. But we ran into some real difficulties, because one of the main problems we have is that the nurses, which are the backbone of care in the hospital and the backbone of really dealing with everything in the hospital, are incredibly busy, as probably everybody's had experience with on some level. And the problem that we ran into then, this factory clean out-of-the-box situation, was it really was about 20 steps that we had to go through to get it back to where the patient could use the tablet. If you're kind of buying this off the shelf, not such a big deal if you're customizing it for yourself the first time. But if nurses have to do this every time a new patient is admitted, it just isn't practical. I mean, it took way too long.
Well, and it's not in their skill sets either. But talk a little bit. I want to dive into the technology issues in a minute, because I know Kyle is going to talk a little bit about some of the things that we have to do. But when you went around to the stakeholders throughout the hospital and thinking about what's the business opportunity, what did those discussions look like?
in terms of being able to, for the patients to use the tablets and how else everybody would work with it. It was something that, you know, the patients loved the tablets. They love the idea of the bedside app where they can kind of find out specifically about their care. They love to have that ability where, you know, a lot of people would come in and they might have a phone or something, but they didn't have a tablet, they didn't have a computer, they didn't have any way to kind of get to the outside world in that sense. And so, you know, in fact, we have a lot of patients from out of state, for example, that come from surrounding states. So they use this to Skype or interact with their family members in different parts of the country. So yeah, so the tablets were huge for us. I mean, this was a really big project that we took on, and something that was really, I think, not only beneficial to patients, but patients really liked. And that the staff in the hospital found it really useful because, you know, an informed patient is a kind of an involved patient in that way. So it's really key for us.
Yeah, you've talked about, you know, an informed patient is a good patient or a better patient. It makes them feel more comfortable, and the fact that they can engage with other family members through the tablets or have the comfort of being able to watch their Netflix or other entertainment actually makes it a more restful journey, and I guess a more restful journey helps in the recovery process as well.
Yeah, absolutely. Absolutely.
Kyle, when Ed came up with this idea, what did you think? What were your first thoughts?
Actually, I thought when it was first presented, it was a great opportunity. And
did he, you know, the journey about privacy and some of the challenge that was on your mind had to be very top of mind, and I don't know, he probably wanted it yesterday. What did you think about all that?
Oh, well, yeah. You know, the business impact was, you know, this is a great opportunity to give a tablet to a patient, but technically, I had to be concerned about how are we going to get these devices deployed, the ongoing maintenance, and actually the removing the personalized information, and that's. I believe when we started this, you know, the first thing that came to my mind is how can we remove this personalized information, and that's where factory reset first came to mind. And Ed was doing some research and found that there were some Knox customization utilities from Samsung that we might be able to leverage, and we went ahead and approached Samsung about some of that, and that's where we found a utility or process that worked fine for us.
Yeah, Valerie, did I hear you started to weigh in there?
No, I'm sorry. I thought you said Val instead of Kyle.
Oh, sorry. Bharat, talk a little bit about HipaaxÚ's. You have a sort of a different market that you're addressing. I find it very provocative, and you've had some experience in healthcare and other markets. Talk a little bit about what you've done and some of the challenges and opportunities from a business standpoint that you see with some of your customers working with Samsung.
Sure. Thanks, Bob. Yeah, so we've got a platform solution that runs on wearables. So mobility is not just about phones and tablets anymore. When we first started building out a platform 3 years back, or actually over 3 years back now, we were focused more on the healthcare vertical, and we were interested in sending communication out from the OR out to the floor nurses outside to the PACU, getting the collaboration going. And very quickly we realized that there was applicability in other verticals too. And since then we've been working with customers in manufacturing facilities, all the way from theme parks to hotels, restaurants, airports, manufacturing companies, and so on and so forth. So what approach we took was we took a consumer device, which was a smartwatch, which had just been introduced in the 2012-2013 timeframe, and we introduced that into the business space, into the B2B space, making that a device that a worker, a healthcare worker, such as a nurse or a doctor, or in a manufacturing setting, an engineer in a plant, or in any vertical, the employee would wear the device and be completely hands-free and be notified of emerging data events in their business. the challenge was, how do we manage these devices? How do we be able to scale up rapidly? And as we started to deploy the solution out in various verticals, we were very fortunate to work with Valerie and the team at Samsung to be able to create, or Samsung helped us with developing the mobile device management capability on wearables, the enterprise mobility management capability on wearables, EMM and MDM, that has actually helped us to be able to scale. And as we've gone into the various verticals, we've helped solve challenges that are very unique in each of these verticals. So a restaurant had a very unique mobility challenge as opposed to an airport, as opposed to a hotel or a theme park, and we've been able to solve all those unique challenges with a platform approach that our TaskWatch platform delivers, where we can not only configure the device using the MDM solution or manage the devices remotely using EMM, enterprise mobility management, but we are also able to use TaskWatch to configure a business's unique application requirements and processes by configuring on the cloud and delivering that content from a system of record, which may be an EHR system, enterprise health record system in a hospital in the back, or an enterprise resource, ERP system such as SAP in the back, which would push information or sensors sending real-time information into wearable devices. We can do all of that through configuration. So it's a unique and broad area of focus because we're working with many different verticals.
That's pretty interesting. Let me move down in some of the key technical challenges and observations. And Kyle, you guys talked about the importance of maintaining financial information, and you began to allude to the sort of safe turnaround to wipe history and data that related patients and during, assuming during March, or maybe there's scenarios, and the fact that the nurse's core job isn't about device provisioning and so on and so forth. Talk a little about how you work with Valerie and her team, and Valerie weigh in about how to overcome some of these technical challenges that you guys are facing.
Okay, so I think you're breaking up a little bit. But one of the things that once we realized that we had, we liked the product, we liked what we were doing, but it wasn't tenable in terms of how long it was taking for the nurses to really be able to use it, and we were afraid we might lose that kind of momentum that we had. So we did turn to Samsung and say, and Valerie and her team and say, we love this, but we need some modifications and we need some help kind of developing this a little further so that we can kind of have it in a much more usable way. And I think, and Kyle and I working together, talking with them and trying to figure out what was that best methodology. So maybe Valerie or Kyle, you can kind of talk about then those next steps that we took for that.
Yeah, definitely. Another thing I wanted to call out to that point is both of these solutions that we're discussing today required further development from Samsung. So I think that really just speaks to our commitment to our partners that we will come up with a solution for our Samsung device deployments. For instance, with the solution for UC Health, the Knox customization tool was able to do the reset of the devices and basically put it back into a specific image or configuration. However, they wanted it to be in less time, even though that tool already reduced it down from around 45 to an hour to 10 minutes. It still required a couple button pushes, and the nurse's requirements were really minimal touch, minimal time. So we were able to engage a partner to develop the solution that really drove that nurse satisfaction to the end user, to the person that's actually performing the resets.
So I guess that was one of the things I was really interested in the early deployments and trials. as these tablets moved from one patient to another, it took something like 45 minutes and 20 screens and 20 steps, as I remember going through the process. Where have you guys arrived at? How much better has it gotten?
Tremendously. I mean, we have it down basically to about maybe up to 60 seconds, but usually a little less.
Oh.
There's basically just a passcode that's entered into the application that we have generic that patients can use if they want, if they feel necessary to wipe their own data, and it basically wipes it completely, and then the image stays the same, and we're back to that state where the next patient can be enrolled into bedside for the tablet.
So is it now a single button, non-technical handoff that the nurses can take place to take these tablets and move them from one patient and re-provision them for a new one?
Pretty much. I mean, it's basically you launch the app by tapping on it, putting in the passcode, and boom, you're done. So yes.
So there's a number of different solutions behind this. We had the Knox custom configurator, and we had some other technologies that you brought to bear here. Can you talk, you and Kyle, talk a little bit about that? And Valerie certainly weigh in.
This is Kyle. When we first began the process, again, like I mentioned earlier, and as we're in the key challenges section, one of the things we were really concerned with was removing the patient personalized information on the tablet. And again, when that was brought to me, it's like, well, this is going to take quite a while to develop, and oh, well, we only have a couple weeks before we're going to deploy. And so the first thing that came to mind was, of course, the factory reset. And when we approached Samsung, there was actually some of the configuration, the customization tools was able to automatically deploy customization, applications, background screens. Restrictions was a big concern. You didn't want patients going in and changing too many of the settings. And we achieved that with some of the Samsung customization tools. But again, the process was to do a complete reset of the tablet, and again, that was just taking too long. And so we just kept exploring, and I think that's where Samsung was able to step in with a custom written application.
Valerie, do you want to talk a little bit about the data eraser application and how that came about?
Sure. So as I mentioned earlier, really UC Health needed a faster way to reconfigure the devices and set them back to the initial configuration as they were being assigned to the different patients. So we basically worked with a partner that was able to integrate the custom toolkit solution that they were already using and create an application that would allow them to do just that with a single push of a button.
And that's great. That was one of the key aspects that took this from a 45-minute real problem for a lot of the nurses who are not technical, walking through a pile of screens, down to, as Ed said just a few minutes ago, I guess, a 60-second or less push. One of the things that's on my mind here is it's one thing to take applications that you know about, and I guess you preload a browser. How do you get rid of the browser history? And how do you start thinking about the other applications? Because you talked about the fact that you allow patients to download other applications. I don't know if you contain those by a whitelist. How do you start thinking about those and inspecting to remove applications that just you hadn't planned for, I guess?
Right. So there is a whitelist for things that we maintain. And I let kind of Kyle and Valerie maybe go into a little more of the specifics, but we basically came up with a standard list that we know that patients mostly would want. Netflix, Facebook app, there obviously is a browser on there, as well as a couple games, Candy Crush kind of things like that, the basics, where those will be whitelisted, so anything from there would be wiped, but the applications would stay. And then anything else that the patient might have downloaded, if it's not on the list, exactly that would be wiped out completely, the application itself. So we wouldn't have to worry from that perspective. So if somebody had a unique app or like a CNN app or something like that we hadn't put on there, that wouldn't be on the tablet every time. It would be up to the user to download what they wanted.
So
yeah,
you fundamentally. Go ahead, Kyle.
Yeah. Also, the applications that aren't standard on the tablet, the Chrome browser and so forth, our own personalized Epic Bedside application, the Data Racer application, a couple of the other games, all come from the Knox customization solution that we chose. So, after a factory reset, and we use the customization tool we have right now from Samsung as the one-time configuration after a reset for both troubleshooting. If there's ever a tablet that we just question, we could just do a custom, a factory reset, and that totally erases anything that could be legacy out there, and then sets it back to reset, and then the customization option starts the download of our own applications and restrictions.
So through Knox, you take advantage of the enterprise mobility management systems and the MDM provisioning that goes along with all that to take, I'm assuming, some sort of payload of applications that by design you're pre-provisioning on these applications after you do the reset. Is that true, or is it something different?
Well, I think you made the statement MDM, mobile device management, as part of this. That the Knox or Samsung customization portion really only just deploys the applications one time, and then after that there would need to be an integration with your own MDM or other mobile management. Right,
okay. But the real critical factor here is making sure these devices are clean, that we're HIPAA compliant and so on and so forth, and that we make this very easy for nurses to hand these devices from one patient to the other. Is that a pretty good summary there, I guess? Now, Ed, you also talked about the fact that you started off in a couple of facilities, but now you're working to scale. I guess there's a new hospital being built. What's that scenario look like?
So yeah, we've moved. We first, on a trial basis, deployed this on our oncology floors at our main hospital here in Denver, and in two different units there. And we since had expanded that to two of our hospitals in the north region, about 60-70 miles from the main hospital, in a couple other units. But we just recently built a newer hospital up north as well, where we're deploying it in the whole hospital, and which has really been quite a boon and working well. So we went through, and I'm happy to go into more details, but I don't want to belabor it, but we had started where we were giving the tablets to the patients, and then each time the nurse would bring it in, but we've moved more towards a scenario where the tablet is in every room and for the patient, so they're able to, it basically becomes part of the equipment in the room. So we deploy it within the room. So everything's done within the room by the nurses and the patients. So, and that's part of the way that we're expanding this larger. And just having it really expand throughout our whole health system is our goal from there.
Interesting. Barack, I wanted to talk to you a little bit about some of the applications that you and I have talked about in the back, and specifically with wearables. You've got some really interesting views on how wearables are just not a watch for an average person, but they actually have some business applicability. You talked about restaurants, for example. Can you talk a little bit about what those look like and what some of the challenges and opportunities that you see as you work with some of your clients?
Sure. Like we were mentioning, we've got applicability in multiple verticals, and some of the key challenges that we solved in the hospitality space, if we were to dive into the restaurant scenario, was we were initially trying to solve a problem of notifying a server while they were constantly mobile in the restaurant. They wouldn't be able to always go back to a monitor to see information that they should be doing. They wouldn't be able to communicate back to a back-end system, even if they were able to get that information. And they could obviously not reach out to a phone from time to time as notifications came in, because their hands would be busy. So if we were not considering wearables such as a smartwatch, there was no solution available. And we were solving the problem of trying to get information into the hands of the servers. The way we did that is we integrated with a table management system. So when a guest would walk into the restaurant, and the host would be ready to get them seated, the server could be in the back of the restaurant. They may be serving other tables, but they would get a notification that you're getting a party of 5 on table 10, for example, if that's the table that the guest was going to get seated on based on what the host did. So even before the guest would come to the table, the server would know that. And the server would be able to greet the guest within a minute. That not only increased customer satisfaction, which is more likely to bring the customer back in, but the server's tips went up too.
That's interesting.
And then additional notifications, like when food was ready, that the server needed to go back to the table for a drink refill, for example, bussing the table, sending notification back to the host for the table to be released to the next guest, and so on and so forth. Creating an entire life cycle of workflow and sending the right notifications to the right person at the right time helped us increase revenue at the restaurant, because we were able to turn tables faster. So instead of so for every 150 table seats, for example, we were able to create 10 additional table seats, without any investment in real estate, without any additional investment in the kitchen or staff, just by creating more efficiency. So this was a very unique challenge in a restaurant scenario. And to talk a little bit about the uniqueness of what we were able to do in a completely different setting, at an airport, for example, the challenge was being able to service certain areas of the airport, take care of security, safety, sending the right notification to the right people at the right time, which would help in managing staffing and also lower cost. So at the airport, what we did is we used sensors to count the number of people going into restrooms. So the sensors, when a certain threshold was reached, would report information over to the service crew, letting them know that a specific restroom needs to be serviced. So rather than putting every restroom on a schedule and servicing them, whether or not it has gotten utilized as much or not servicing it, even though within that window of time, if it got overutilized. So it was a challenge that's not easy to solve, because you could be overstaffing, yet you wouldn't be able to deliver the optimum quality of service if it got overused. So to solve that, we put sensors that send notifications, and the service was done in time to optimize cost as well as the level of service.
Right. What are the, I guess I could make the case that people could walk around with their phones in their pockets and wait staff uniforms, things like that. Why wearables, and why not just people bringing their phones to work and taking advantage of that capability? What enhances the kind of value add that you've been talking about?
Yeah, there's research. Yeah, I completely, it's an excellent question. The research that's available, research information from leading companies, and I don't know if I should name them, like Forrester, for example, says that if your employee receives a notification on a wearable device, they are likely to respond within 3 seconds. They will get the information within 3 seconds, and they can act on it. And then it's more about enforcing the process. if you deliver information or notifications on a mobile phone, for example, that may be in the pocket of your employee, if your notification is time sensitive and you need action to be taken within a window of time, you may not get that because it can take up to 10 minutes for an employee in a workplace to receive the notification and to respond on it when it comes on the mobile phone, because it's not always in their hand. They may be in the middle of something else. The phone may be in the pocket. It may be kept elsewhere, and the response is not optimum. That's the key differentiator between using wearables and sending notifications on mobile devices such as phones.
So in the case of hospitality in the airport example that you were talking about, I know you and I have talked about other examples. Talk a little bit about the host, whether it's the airport facility or the hospitality restaurant facility. Do they need to put on-premise servers? Do they need to be provisioning devices? Talk about how things start to work. What's required?
Sure. So our platform is essentially, the way we've looked at it is it's a layer that sits on top of the various configuration layers on the mobile device. So just like an MDM solution, a mobile device management solution that we've talked about, configures the device, locks it down, does all those things, wipes it down, and so on and so forth. And then an enterprise mobility management layer on top that helps provision those devices for business use, but a business is left to plan for themselves on how they are going to utilize that mobility device for their business challenges, to solve business challenges. And that's where we come into the picture. So we've got that layer that sits at the topmost level in this whole stack and allows a business to configure their solution without writing a single line of code, connect the solution back to their systems of records or backend systems, sensors, or whatever it might be, any kind of a data asset that a business might have. And the business could be a hospital, it could be a manufacturing company, it could be a theme park, a hotel, restaurant, airport, or any kind of business that you might imagine. And so when the data asset triggers an activity and there is action that needs to be taken, rather than to wait for an employee to find out that something needs to be done, in which case a delay gets caused, you can actually send a notification to an employee on their wearable device through configuration, zero code to write. We can deploy within a matter of weeks. And not just that, as business needs evolve, in a very agile way, we are able to take responses or feedback from the business and update the configuration to make the application work specifically to how that business wants it to work. Whether it's through sending media content across into the wearable device, such as voice, pictures, or it's just content from a backend system that needs action, getting that action taken, taking responses back from the employee and sending it back to the system of record. All of this happens through configuration.
So with these solutions, you buy license or your client, do you buy licenses for Knox on behalf of your clients? The clients do it. Who does that provisioning and who does the maintenance? And I guess the second part of that question is, when I think about wearables, an environment where we talk about BYO devices, BYO applications, who are the hospitality owners and the airport owners on behalf of their employees provisioning and handing out wearables by shift? What does that all look like?
Yeah, so all of the above. To talk about the specifics, so business might have employees that have their own wearables that we could configure using our EMM and configure within TaskWatch. And in most cases, the business owners would understand in a given shift how many employees there are going to be, and they plan for that. And we have a team that actually kits and ships the devices after all the configuration's been done. So it's all taken care of. When the watch gets delivered, in some cases they are functional devices. So a department might have 5 watches, and when their shift starts, employees come in, pick up the device from the charging cradle, and just go about their job, and their notifications start to come on their device. They're able to interact with backend systems using the watch. And when we talk about backend systems, it's not just one-to-one. So there's a simple interface on the watch to make it very, very easy based on the form factor. We can't make it complicated, but in the back, there may be complicated systems that are generating that data event. There could be multiple systems, and the person that's receiving the notifications, these are tasks, very pointed, directed tasks that please go and do this. When they go to, and they have a certain amount of time to do it, the watch tracks it, reminds them if they need to be reminded, and there's a dashboard that actually gives an update to the business in terms of how operations are progressing. And when they complete the task, they're providing responses back, which go into the backend system as well. So we take care of all of the configuration, and these are functional devices. In some cases, business owners want to give devices for employees to take home. That's their device. They bring it into work every day. And in some cases, we can take be a BYOD device, bring your own devices, where employees may have their own smartwatch, and we just take the ID and configure it for their devices to receive notifications and for them to interact with backend systems.
Great. Valerie, you know, you work with a wide range of clients out there, and when I look at the attendee list, it also is a wide range of different business leaders and technical leaders out there. If you had 3 or 4 recommendations as people begin to, you know, think about the solutions they want to deploy and how they should be deploying them, the kinds of things they're thinking about, what would sort of be your top 3, 4, 5 things that you see and the kind of recommendations that you ask people to consider?
Well, I think I can narrow that down to probably the top 2.
Okay.
And because I would need another hour and a half if I was going to go into the top 5. But I think configuration, that's a big one. You know, when you're doing an enterprise deployment, you need to configure the device, and you need typically admins want more control. And that's something that Samsung offers. So through our Knox platform, you already, by choosing a Samsung device, you're already one step ahead of all the other OEMs when it comes to security. And that's what Gartner has said over the past multiple years. So that's not just me saying that because I work for Samsung. That's actually out there. And we have a variety of certifications to back that up. Now, we also have solutions like we've been discussing during today's calls that will help leverage that, and there really is no other OEM that's going to provide you with the level of customization and the ability to really just control and configure these devices. So that's number 1. If you have anything that requires any kind of configuration, keep our customization tool in mind and the configurator tool as well. And then number 2 is manageability. We do have the EMM or MDM solution as well. We definitely partner with all the other big MDM providers. So sometimes when there's maybe a smaller deployment, or maybe it's a separate deployment and you want to do a proof of concept or whatever it is, we have a mobile device management available as well.
So Valerie, I know you have a lot of experience in these different forms of configurations and the tools within Knox, but I also get the sense that you have a pretty good bench of partners that have experience in a lot of different verticals. Some of those inside, and some of those that are part of the overall Samsung ecosystem. First of all, is that true? And second, how do you bring that to bear when you sit down and hear some of the requirements in diverse areas like healthcare, and specifically within the Collin group, and how do people get the scale, and how do people, you know, address that key issue around configuration you're talking about? What do you do? What should people be doing with you? Think about.
Okay, that's a great question. Yeah, we have a team dedicated for enterprise. So you've got, typically you're going to have a key account manager or some kind of a business account manager that supports anything, you know, overarching Samsung mobility. And then they've got a team of experts that support them in anything from technical pre-sales and Knox and services, deployments, things like that. So we have a very solid team in all the different aspects, and even a team that's dedicated to alliances and partners. So typically what we'll do is sit down and meet with the customer, understand what their needs are, and if it's not something that we can provide right out of the box, then we start reaching out to our partners and seeing, okay, we have this piece, do you have this piece to complete this customer's requirements? And then working with them to either build it, whether it's through app dev or putting our solutions together to come out with one unified solution that'll meet the end user and the customer's needs. And I think that's exactly what happened in both of these scenarios that we're talking about today.
Yeah, Ed, you really talked a lot about that in the call before the webinar, about the fact that there was a lot of aspirations about what you wanted to get done, and you and Kyle had talked about some of the provisioning and the security issues, and the importance of being able to have a partner that had certain characteristics. I know listening was one of those, but there were some other things that you were talking about in terms of the importance of not trying to do this alone, specifically with internal resources, but both time, money, and efficiency really was gained by bringing partners to bear. Can you talk about the importance of partners and how that all worked? And I guess, you know, feel free to talk about Samsung if that really was important to you.
Sure. Yeah, no. I think having the partnership was key for us. I mean, yeah, there's different we're kind of a university, a medical center. There's lots of resources, but not quite what we needed, and certainly not in a timely fashion to be able to do some of this. So I think having that ability to work with Samsung is key for us, actually, in a lot of ways. That, frankly, honestly, I was a little bit surprised. I thought it might be, you know, a bit kind of top-heavy, perhaps, and not have that ability to kind of meet some of our needs, or at least in a timely fashion. But very pleasantly surprised, where I think this collaboration has been really helpful to us, in kind of sounding out, helping us figure out exactly what our needs were and what the possibilities were that are out there. You know, yeah, with some research, and we kind of came up with Knox and started that way, and it really, I think, started us on the path. But once we needed a deeper dive and that ability to kind of more control it, and certainly in a much faster method, yeah, it's proved to be a very fruitful and necessary kind of collaboration and partnership in that way.
Yeah, one of the things you had mentioned to me was not just the technical expertise that they could weigh in, but the Valerie team actually listening to your requirements and churning them down and comparing them against deployments that they've worked with others. You know, the importance of a partner who's willing to listen, react, and take action was one of the things that you were talking a lot about, and it felt really good about. Can you talk a little bit about that?
Yeah, I think, well, and it was a partnership that helped us define what we needed. I think a lot of times, you know, we had a sense of what we wanted, and what might work best. But I think in talking to Valerie, talking with folks at Samsung, it actually helped for us define how that might work and what we needed. So it wasn't just, it really helped to narrow, I think, some of the questions and the ideas, coalesce some of our ideas, actually. I found that particularly helpful. It's kind of like the idea of sometimes you don't really know what you want until you kind of say it out loud and speak it in that sense, right? And I think in that sense it was very helpful, and it continues to be. I know, and Kyle perhaps can speak to that too, but I think just that the technical back and forth and the ability to kind of understand a little bit about what's out there and what the possibilities were. Is that
Kyle, kind of... Yeah, Kyle, you're a smart, experienced, technical guy, but I always find that when I get into the middle of a lot of these ideas that I take advantage of the partners to learn other things. Was that the case? Were there things some things and configurations that you hadn't thought about that, as a result of the dialogue with your partners and other folks within the organization, that came to light during this process?
Oh, absolutely. You know, and again, working with Samsung, a lot of great ideas that we may not have thought of. Sometimes you can only just generally, as an outline, present what you want, and it takes other eyes, other ears to interject some possible solutions or different directions.
Yeah. Let's turn a bit about, you know, what does success look like? How important is scale? We talked a lot about allowing non-technical people whose core business isn't about deploying things like wearables and laptops. But Ed, how do you define success?
Success for us was in getting the patients, not only getting the patients to use the tablets, but actually getting the nurses to deploy them. So I think, you know, it's a great concept, the idea of getting patients involved in all of this, but the bottom line was, if the nurses weren't deploying it because it was too much work, it wouldn't happen. So I think the success for us was getting it down to the simple process, so that for the nurses the workflow was really, it was kind of a simple, quick thing that they would see the benefits from, versus seeing it as just another make work or more work kind of thing for them.
Did that happen overnight?
No. It was quite a process, and honestly, frankly, it still is ongoing. But I think, you know, when we introduce this in an existing setting within a hospital, it does take more work for sure, because it seems like something additional that's added, even if it can be quick. The quicker it is, the better. What we see, and I think you alluded to before, in a new hospital where this was part of the process from the get-go, it really was kind of a no-brainer. It just became part of the process. You know, you go into the room and the tablet was there, and they would use it. Nurses would kind of provision it, and it would get used. And so for us, and this is, I won't get into the details here, but it's part of an ongoing thing where we use the tablet and this technology as part of an overall strategy within the patient's room to incorporate everything into one, whether it controls the TV and the heat and the blinds and all those kinds of things. But it's a key element, because if for any of those things to happen, it had to get off the ground, and the nurses had to buy into it and realize that it wasn't more work for them, but in the end, it was going to make their lives easier.
So it wasn't just about bringing patient care to the bedside to this technology. It's actually beginning to create an immersive patient care, I guess, environment. Whether, as you said, you're creating a smart room, I guess is the thing when I start thinking about controlling lights and controlling blinds and TVs and things like that. It's very, very interesting.
Yeah. I mean, the bottom line is, for us, it's the healthcare app and how patients interact with that, and then become involved with their healthcare. But in order to make that happen, I think all these other things need to go part and parcel of that.
Right.
And it just kind of has helped to define or move us towards that whole idea of a smart room.
Bharat, when you think about some of the organizations that you've been working out there, how do they define success, and what does that road look like?
Yeah, so success for our customers are different things in different verticals. In some cases, it's more revenue. Other cases, other verticals, they may focus more on an enhanced customer service experience. In other areas, they focus more on improving productivity to lower their cost. So it's everything from customer service, improving productivity, lowering cost, impacting revenue, and even taking cost out of existing processes. In manufacturing, for example, making product faster and cheaper, not having product that's not within tolerance limits, for example, being able to respond much quicker to something that's not going right. So it's different things in different verticals, but we're able to impact revenue and lower cost and improve experience.
Okay. So I've got a pile of questions that are queued up here. The first one's a real easy one. Valerie, there's 3 or 4 people that are asking for contact information. So could you give your contact information? Some people are saying they have some project they'd like to discuss.
Yeah, absolutely. Would it be best just to reply in the chat so everybody can see it?
Why do we do that? I don't know how many people are just listening and how many people are actually looking at the slideware. So maybe do both. If you could just, I don't know, whatever your phone number or email address.
Sure.
Both, yeah.
Sure. Email would be best because we are regionally, our support is regional, so that way, we could offer support at least within the same time zone, and we're able to travel to the customer side if necessary. So it would be really helpful if those emailing me can provide the name of their organization and the city and state that they are headquartered in. That way I can make sure they have the correct support. And with that said, my email address is v.espinoza, and that is ESPINOZA @samsung.com.
Great. Let's start with UC Healthcare. I guess maybe this question goes over to Kyle. How do you deal with device and software fails as you move this into production?
I didn't quite catch that question. What was that again?
I said, how do you deal with device and/or software failures as you moved into this as a production environment?
Well, an example, I think, software fails. Well, it's kind of difficult to answer because I hadn't seen that very much. I haven't. One of the things is the Samsung customization as it is being applied to the device. We were using an external network, the visitor network, and that's more unreliable. It's not as a reliable network, and the customization application on the devices would just continue to retry until they finally succeeded. Sometimes it would take a long time to download the configuration profiles and the applications. The other scenario, I guess, is while we were writing the custom application, we stumbled across some licensing issues, and Samsung and the development crew was real helpful in working that through, which took an extended amount of time, but we finally got that fixed.
Bharat, same question. How do you deal with device and/or software failures in some of these production deployments?
So we just have to be proactive and stay on top of build redundancies and stay on top of issues. Most projects that we started early on, there were unexpected things as we learned and built things and delivered, but it was all about how quickly we are able to respond and address any needs that are coming up. And as we become more mature, we've built redundancies and built processes that helps us put control around variations that could possibly come up and be able to address those before it starts to impact the business.
Great. Let's see, I have another question. I guess this goes over to Ed. Any issues in the healthcare setting with disinfecting the tablets and wearables as they move into the other? Yeah.
Yeah, good question. So, no, there's two methods that we use for that we started out with. One is we actually purchased a UV cleaner where the tablet, we can put the tablet in there, and it's basically a 120-second, 2-minute process, and that will clean anything on the tablet without harming the tablet at all. And that includes like C. diff and pretty much anything you can think of, and that went through past our infection control specialists. We also use Cavi wipes to wipe them down as well. We do have external cases on the tablets, which we leave on, but they can be taken off if necessary. Right. But so those are the two things that we use.
Okay, great.
And
well, again, my name is Bob Egan. My contact email for any follow-up that I'll make sure we'll get back to all of our panel members is bob@sepharim, SEPHARIM.com. I want to thank you all for joining us for the last hour. Thank you so much for your questions. If you have other follow-up questions or need other material, please feel, again, to reach out to me at bob@sepharim.com. And I'll be happy to pass the questions along and supply any of the materials. So thank you all again. I want to thank Valerie, Ed, Bharat, and Kyle for joining me, and hope everyone has a great day.
Thank you.